This video will show you how a caregiver will wrap your arm as part of your lymphedema management. First, here are the materials you will be using. 1 elastomole. 1 roll of 6 cm Comprilan bandages or any comparable short stretch bandage. 1 roll of 8 cm and 2 rolls of 10 cm Comprilan bandages. 1 roll of foam padding or 1 to 2 rolls of Artiflex padding, and stockinette or cotton stocking. You will also need masking tape. Pre-cut 6 to 10 pieces of masking tape. Have all your bandages and tape ready on a table in front of you before you begin. Start by putting the cotton stocking over the patient's arm. Cut a small hole for the thumb. Fold the ends over the wrist if the fingers need to be wrapped. If the fingers are not to be wrapped, please skip to the section in this video discussing the foam and padding. Step 1. Bandaging the fingers. Take the elastomole in your hand with the loose end towards the floor. Place the elastomole on the patient's wrist and wrap around the wrist once to anchor. With the elastomole at the top of the hand, direct the elastomole towards either the thumb or the pinky finger and wrap the finger twice, covering the whole finger except the nail. The elastomole ends up on the inside of your thumb. Direct it over the top of your hand. Bring the elastomole under the wrist and over the top of the hand, and wrap the next finger twice, the index finger. In the same direction, bring the elastomole under the wrist to the other side of the wrist and over the top of the hand and wrap the next finger twice, the middle finger. In the same direction, bring the elastomole under the wrist to the other side of the wrist and over the top of the hand and wrap the next finger twice, the ring finger. In the same direction, bring the elastomole under the wrist to the other side of the wrist and over the top of the hand, and wrap the next finger twice, the pinky finger. The top of the patient's hand will be covered with elastomole, and the palm should be open. Use the remaining gauze bandage and wrap gently around the wrist. Do not apply any tape on the gauze, and make sure the whole top of the hand is covered with elastomole. Pull the cotton stocking over the hand and insert the thumb through the hole. Step 2. Applying foam or Artiflex padding. You will need to cut a 3-inch rectangle at one end of the padding. The foam or Artiflex is used to pad the arm and make it more like a cone. Place the padding over the top of the patient's hand with the 2 loose ends of the foam held between the patient's fingers. The patient will make a fist. Roll the padding in a spiral around the hand and up the arm, making sure the foam overlaps a little. Fold both ends of the cotton stocking over the foam padding. Do not apply tape to the padding or stocking. Step 3. Applying bandages. We will use the 4 bandages and tape next. Take the 6 cm Comprilan with the loose end towards the floor. Place the bandage on top of the patient's wrist and wrap around the wrist once to anchor. With the bandage back on top of the wrist, direct the roll towards the knuckles in between the thumb and index finger. Wrap the bandages just above the knuckles 3 times, making sure the bandages do not go past the knuckles and into the fingers. From the pinky side of the patient's hand, angle the bandage towards the thumb and wrap the hand at the base of the thumb just below the wrist. Alternate wrapping between the knuckles and the wrist until you use up the bandage. Secure the bandage using tape. Take the 8 cm Comprilan and place the loose end on top of the patient's wrist at an angle. Wrap the bandage around the wrist and go up the arm in a spiral, covering 50% of the bandage each turn. Use tape to secure the other end of the bandage. Gently squeeze the patient's bandaged arm in your hand. There should be a gradual reduction of firmness as you squeeze up the arm. Make note of where it starts to soften. Take the 10 cm Comprilan and place the loose end at an angle at the spot where the bandages are softer to touch, usually a little higher up the wrist. Wrap spiraling up the arm, covering 50% of the bandage each turn. Use tape to secure the other end of the bandage. Repeat with the last bandage. Use tape to secure the other end of the bandage. You have successfully bandaged the patient's arm to manage lymphedema. Make sure they can bend their elbow, wrist, and turn their hand without any pain or difficulty. It is normal for the bandages to feel snug, never painful. If the patient complains of the bandages being too tight, take everything off and redo with less pressure or pull on the bandages. If you have any questions, please contact your therapist.